DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Folks, welcome to DocTalk. We're going to have a great show. We have Dr. Chance Armstrong with us, and we're going to talk about bull health programs, bull development. We're at Auburn University, where Dr. Armstrong works in the College of Veterinary Medicine, and he does work with cattle and beef herds all around the world. It's going to be a great show. Stay tuned.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cooperia, Nematodirus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
Hey folks, welcome to DocTalk. Dr. Dan Thomson here with Dr. Chance Armstrong. And Dr. Armstrong is one of those people that if you get the chance, he's somewhere in the region of your country, you need to go listen and spend some time learning from him. I learn something every time I'm around him. It's extremely humbling. He's here at Auburn University at the College of Veterinary Medicine. And welcome to the show.
Thank you. Appreciate you.
You bet.
Thanks for having me here.
It's great to have you. And so we're going to talk about developing bulls and bull development and bull health programs and vaccines and nutrition and all that. But let's just kind of kickstart it with the nutrition and growth patterns.
Yeah, and we've seen the industry change over the past 20 years where bulls were held out and developed until 2 years of age. They were older, a little more seasoned at that time, definitely. Their puberty status had been achieved at that point for the most part. And now the pressure has been put on the industry from the seed stock standpoint, where we're marketing more 12 to 18-month-old bulls, which is known as a long yearling bull. With that has been increased pressures to push those bulls harder nutritionally, and we've seen some negative sequela to that at a more rapid rate of gain, much like a steer would be. And so we try to be an encourager for those that are developing bulls for a more moderate rate of gain. Will be more beneficial to these bulls to stay in the herd longer, to not have as many health problems associated with their feet and legs and premature development of osteoarthritis. Also, you think about the sequela to a feed bucket can be laminitis, and the side effects of laminitis, which we are different in the bovine than they are in the horse, where it may be down the road when you see the changes associated with their hoof wall. Also development of things like white line disease, like sole ulcers, that can change that calf's life forever before it's ever 2 years of age.
Basically, there's so many times in a bull test, we basically put them in a feedlot, and the bull that eats the most wins.
Right. And they can accomplish those things, but really what we've seen in the literature is that some other things that can happen is they're going to throw down fat in the neck of their scrotum. So if any seed stock producers are listening out there, I mentioned this at NCBA a year ago, a more moderate rate of gain, even though they may lose some of that sale fitness, I guess, if you want to put a term to it. But if you need more bulls to pass the breeding soundness evaluation, a more moderate rate of gain will behoove you because they can't cool those testicles off. I think about it like two sperm-making factories. A bigger factory is better, but you have to have that air conditioning in that factory to produce good product. And where that happens is right at the scrotal neck there. And if they throw down fat at the scrotal neck, that's where the air conditioner is, essentially the pampiniform plexus, where there's passive heat exchange there. And so that is a negative sequela of a higher energy-based diet that we've seen also with the laminitis associated with lameness. That comes much later sometimes, that can affect them for the rest of their life because of the changes in that hoof wall structure.
And it's kind of an alteration of that, of the blood flow and the inflammation of that lamina.
Absolutely, and again, it just in the bovine it changes the amino acid structure there within the dorsal hoof wall, essentially softening it, and it changes the way that that critter loads that limb, and again, it can lead to premature development of osteoarthritis. Overall, we find that they're not going to have the longevity in the herd that they should. With a more moderate rate of gain, which is, some of the data would be 2.2 to 3.5 pounds per day, and I would argue that that sweet spot for me that I've seen in our studies and also our work here clinically is about 2.8 to 3.2 pounds per day. Push harder than that. There are also some suggestions out there that we haven't really seen the effects of osteoarthritis prematurely forming because of even at that higher rate of 3.5 pounds per day. And so I encourage producers to a more moderate rate of gain, even though they might not be quite as conditioned as some of those bulls that are pushed harder than that, but the long-term outcome and your reputation is going to be better.
You bet. We're going to take a break. When we come back, more with Dr. Chance Armstrong.
I'm Dr. Julia Herman, beef cattle specialist veterinarian with NCBA. Biosecurity can be important on a daily basis with things like bovine respiratory disease or other things. When the threat of foot and mouth disease is talked about within the cattle industry, we really need to enhance our biosecurity plan and take extra steps to make sure that business continuity occurs during that outbreak. Tools to use that include the Secure Beef Supply Plan. What the Secure Beef Supply Plan does is walk through different ways that you protect your herd during an outbreak, and that way you can prove to those outside that you're keeping your animals safe, you're not getting foot and mouth disease, and you're able to move your animals and continue business during an outbreak. For more information, visit securebeef.org.
Thanks for watching Cattle Intel by Neogen.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Igenity Feeder. Igenity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Igenity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Igenity Feeder.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson, and I'm here with Dr. Chance Armstrong, and we're at Auburn University, which is in Auburn, Alabama. Dr. Armstrong is an associate clinical professor. He is a bovine practitioner and spends a lot of time in our field and sees a lot of bulls and a lot of cows and a lot of people. And we were talking about bulls, and recently y'all, and bull health programs, recently y'all have published some research on vaccinations and bulls and their ability to pass breeding soundness exams.
Yeah, me and my colleague, Dr. Jennifer Kozel at Texas Tech University, we performed a study because we had a lot of questions from both veterinarians and producers. Is it safe for me? Is it going to have a negative effect on my bull if I turn him out and we have just vaccinated him with either a modified live or a killed or a product, a biological, as a preventative medicine, and so that was something that was just lacking in the literature. We just didn't really know it. There's so much been published about the reproductive effects, particularly of modified lives in the female, and when we should do that. And so we wanted to do that, and we published this recently in Bovine Practitioner earlier this year, and we found that there was no negative effect whether you chose a modified live or a kill product for your preventative health care. I would encourage you to work with your veterinarian to find out what's best for your particular operation, the challenges associated regionally where you're located.
Yeah, but we see this all the time. We get into a meeting and we have anecdotal evidence, or one veterinarian has a bias one way or the other, and we wind up in these taste great, less filling type arguments
Sure.
on killed versus modified live. This type of research that Dr. Armstrong and his colleagues have done is something that we walk by every day,
Yeah.
and it just gives us a peace of mind.
Sure. Yeah, we saw no negative effects on the spermiogram following those bulls out once from metagenic cycle, and so it just reassures us that by that work that we can choose either one of those vaccines.
What about other, just in the development of the bull, some of the, we've talked about obviously the importance of colostrum and different types of vaccination platforms. Anything that would be there in that development or period that you would kind of flag for us?
Yeah, absolutely. They should be, the bull is often forgotten about sometimes, particularly when they get enrolled into the cow herd. But from a development standpoint, but also when they go to their next owner, they should be enrolled in the same preventative health maintenance program that the cow herd's in.
Yeah.
So things that I think about, everywhere I've practiced has been really wet, and we worry about lepto. Lepto should really be vaccinated. The bull should be vaccinated biannually, just like the cows are for leptospirosis. All the preventative from a BRD standpoint, they should be enrolled in that. And then think about things like Clostridium. We don't think about the mature animal with clostridial diseases, but the bulls, they're in that bullpen, they're establishing a social hierarchy, and you get an opportunity for an anaerobic environment there, and clostridial disease can lead to death in those situations, and they're just too doggone expensive not to prevent that. So annual or biannual vaccination with a clostridial is something really important in bulls as well.
Yeah. Well, it's a great time for us to take a break. And when we come back, we're going to talk about parasites in bulls. You're watching DocTalk. We got Dr. Chance Armstrong. We'll be right back.
John McCurry with McCurry Angus Ranch. We are standing right now in our fall yearling bull pen. On our first initial run with therapies, we commingled 3 separate different pens of bulls together for the ones that's in the sale, and had virtually no issues with these cattle in terms of commingling them and their attitudes towards each other. Didn't have the riding and the fighting that we normally can experience. And I would highly recommend us using therapies, and would recommend that to anybody else looking to do so.
The seeds of financial security today with United Patriot Coins Precious Metal Starter Pack, the Patriot Pack. Exclusive offer for our DocTalk family. Call now and secure your financial future. Strengthen your roots with silver and gold. Call United Patriot Coin today and ask for the DocTalk special offer.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed Lidoband, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. Lidoband, a small device that can make a big difference.
Ranchers, looking to elevate your pasture management game? Turn to Heinen Brothers for expert aerial application. With state-of-the-art equipment and seasoned pilots, we deliver precision treatments right to your fields. From fertilizers to herbicides, Heinen Brothers has your pasture covered. Visit HeinenBrosAg.com to learn more.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Chance Armstrong. And Dr. Armstrong serves here on the faculty of the College of Veterinary Medicine at Auburn University in clinical sciences. He's on the clinics, he's in the classroom, he's doing research, he's practicing veterinary medicine. Just somebody that got a little bit of a passion for our profession.
Yeah, I'm very proud to be a veterinarian, and proud to be here serving at Auburn University. It's very surreal for me to have my training here, but also to be on the faculty here now.
Well, we're sure glad you are,
Yep.
and we're thankful you chose to be a veterinarian because you help so many of us in the beef industry. With that in mind, we've been talking about bulls, and we've kind of talked about that moderate growth rate and to help prevent some things that the higher growth rate can cause. We've talked about vaccinations and that, but parasites seems to be something we have to really focus on.
We do, and it's important to look at some of the latest data and some things that we're concerned about in the beef industry with the onset of resistance to our anthelmintics that we have available to us. And so we don't really have time to delve into too much of that today, but I would tell you to try to work with your veterinarian to maintain refugia, which is a population of parasites essentially that have not been exposed to an anthelmintic or a dewormer. But the bull, particularly when they're developing, all young animals probably need, and there's some advantages to providing an anthelmintic. And then in areas where liver flukes are a problem, like in Florida, all along the Texas Panhandle, Louisiana, where I practiced for some time, that is a major problem and a major deterrent to cattle health, and also the bull will be involved there. From an external parasite situation, it seems like hornflies are just more attracted to bulls than cows. I don't know why that is, and I don't have any data to support that, but when you look at amongst a group of cows that haven't had any type of fly treatment applied just yet, maybe early in the spring, when it's just starting our fly season, it seems like the bull, if he's out there, it seems like they're more attracted to him and more of a nuisance to him when he's not thinking about doing his job, breeding cows. He's thinking about swatting flies. And so it's really critical that we provide the appropriate type of fly prevention for him, for his weight. It's the same with the anthelmintics, making sure that we apply. These bulls can be quite big, over a ton. And so we need to make sure that we give the appropriate dosage if we are going to provide an anthelmintic or a dewormer for these critters.
Well, it's the same way with our cows. Everybody has 1,000-pound cows till they weigh them.
Right.
And if you don't weigh your animals, that you could get the wrong dosage, underdose them, and really, it just helps create more resistance.
Yeah, it leads to the onset or hastens the onset of resistance in that parasite population on that particular farm or ranch. And so it's really important that we provide the correct dosage. And so, scale weights are a good way to do that if you don't have a scale, but investing in a scale is something that I recommend that producers really help you with, application of the appropriate preventative medicine, and also if you do have to treat those animals for something with antimicrobials, provide the appropriate dosage.
Absolutely, and we've seen it time and time again, folks. Whether it's antibiotics, parasiticides, those types of products that are weight-based, they're weight-based for a reason. We're going to take a break here with Dr. Armstrong. We're going to come back and we're going to wrap up bull health programs, bull development. We're here at Auburn University. Thanks for joining us.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Hey, I'm Clark Victory. I grew up right here on this little ranch near Chelsea, Oklahoma. Roped and ranched all my life. A few years ago, I had an injury that created what they call a frozen shoulder. And after speaking with the surgeon in Tulsa, he told me that he could make my shoulder better if he did surgery, but he absolutely couldn't fix it. And I called Kansas Regenerative Medical Center. I did the stem cell replacement. By 12:30, my wife and I had lunch and was driving back to Chelsea. We work around here. Some days we work pretty hard around here, and my right shoulder doesn't get sore. It's like a baby's arm.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight-shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it, though. Go to macrosin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrosin.
Hey folks, for your firearm and ammo needs, for gun safes and much, much more, and to have it personalized, come visit us at United Patriot Supply outside of Seneca, Kansas. You can also visit us online at unitedpatriotsupply.com. Be sure to say that Dr. Dan and DocTalk sent you, and we'll see you down the road.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson, and I'm here with Dr. Chance Armstrong, and we're wrapping up a great day at Auburn University. And Dr. Armstrong and his colleagues have been a great host. And you know, this is an unbelievable veterinary college. It's beautiful here, and unbelievably talented people. And Dr. Armstrong is definitely one of those. When we talk about the bull development, you know, we've talked about nutrition and that, but we got to start out with good structure, right?
Yeah, that goes back to selection. These bulls that have, particularly their hind limb structure, is really important. You know, we see some of these cattle that come, you know, out of shows that really have a post-legged appearance and structure to their back limbs. We know that's going to apply as they load that back limb. They're going to apply a lot of pressure to the subchondral bone, which is going to really cause some pathology down the road. Those bulls are going to get sore. I had a producer this last year. The bull passed the breeding sounds evaluation. He had just purchased this animal. It's about an 18-month-old bull that he was really proud of, and he was a nice-looking calf. And I told him, I said, you know, you need to really watch this calf. He's going to get sore on you. He said, what do you mean? And I showed him what I meant by his hind limb structure. At that point in time, he said, I'm just going to turn him out. And I said, that's fine. I said, just keep your eye on him, you know. He called me about a month into his breeding season, Dr. Thompson. He said, man, how'd you know that bull was going to get sore? The cows are out there cycling, and he's the leader. I said, well, I paid Auburn a lot of money to help educate me so I could help you. But he was remarkably surprised that I knew that was going to happen. I said, well, it's just a good chance because he was so post-legged. So really important, not that it always happens that quickly, but definitely can affect their longevity and not work as long as they should. And that purchase is such an important part of their overall sustainability of the operation. So I pay a lot of attention to their hind limb and their feet structure. A lot of breed associations are really paying more attention to this, and I applaud them for that because we see so much pathology coming to our hospital with young bulls that really have not even matured yet, that have some real significant pathology to their feet particularly. And so that selection is really important.
Yeah, and I think that as we continue to finish these cattle heavier and heavier, we got to have bulls that have, and cows that have the right conformation to produce a steer in a feed yard that's going to be able to carry that weight to the packing plant.
That's right. Yeah.
And it's just all relates to all of us. But if you're going to kind of wrap up or summarize bull health and bull development, I know I pigeonhole you into something you've studied your whole life, and now
well, it's something that's really important. But I think I can't emphasize the biggest problem we see is a sequela to the feed bucket. So a more moderate rate of gain, we stay in that sweet spot, 2.8 to 3.2 pounds per day is really, really important for their long-term health of their feet, how they travel. And also if they're lame, they cannot produce good semen. It's going to be a stressor to them. It's going to directly affect the testicle, their sperm-making factory. And so important for everything that he does. And so it all starts there. Don't forget about them. Even when they get enrolled into the mature cow herd, they've been on your place, don't forget about them because they should get the same preventative health maintenance that your cow herd should get. And so they're even more important as far as the profitability of your operation. So definitely we should put those bulls first. And from a parasitic standpoint also, we want to try to prevent that, but it also trying to maintain our refugia and make sure that our anthelmintics are going to work into the future so that we don't hasten the onset of resistance in the U.S. cattle population.
Yeah. Well, thanks for joining us today.
Yes, sir. Thanks for having me.
Yeah, it was my pleasure and our pleasure. Thank you for watching Doc Talk. Remember to always work with your local veterinarian. If you want to find us, you can find us on the web at www.doctalktv.com. I'm Dr. Dan Thompson here with Dr. Chance Armstrong. We're in Auburn, Alabama, and we'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
One animal has this huge impact on your operation.
BVDV is one of the most costly bovine diseases, with losses of $15 to $88 per head.
The virus will actually cross the placenta and get into the fetus. As it's developing, its immune system will recognize that virus as it's supposed to be here. And so then that's where our persistently infected animals come from. They're going to shed that virus their entire life, and then it's going to impact your operation.
It is important to work with your local veterinarian and partner with IDEXX for the best solution for your operation.